School is out, and that means kids are outside playing more often. Right now, the emergency room at Children's Hospital is busy handling more summer injuries. Our Dr. Frank McGeorge has more on what parents can do to reduce the risk for kids.
Well, this morning I'm joined by Dr. Kelly Levasseur from Children's Hospital of Michigan. She's actually the assistant medical director in the pediatric emergency department. And the reason that we're talking to her today is because there's been a change in the seasons. Kids are out of school, it's summer, and that means a change in illnesses, injuries. So Dr. Levasseur is a common contributor to what's going around, and she has indicated that there has been a notable shift in pediatric illnesses and injuries. So why don't you talk about what you've seen lately, Dr. Levasseur?
Sure. So we know that summertime has really hit when we start to see way more outside injuries. We see a lot more kids with broken bones, more kids with concussions. So they're outside, they're playing just with their friends, or they're outside playing sports more often, getting their heads hit. We see much more cuts. Just from kids getting into things, falling on things. So those are really the big things, are just outside injuries.
Now, you're obviously in the emergency department, so those are kids that have more serious, severe injuries. I guess as a mom, what's your sense of how often kids in general get hurt and how often maybe parents choose to stay home? And what's a deciding factor in deciding one way or another?
So that's a great question, because certainly I am biased by working in a pediatric emergency department. I would think that a lot of kids do come in. However, we know that that is not the case. And it's up to every parent and what they're comfortable taking care of with the minor injuries. So you have a minor cut that you can get the bleeding stopped in a couple of minutes, and maybe it doesn't look too deep. So you put a Band-Aid on and you move on and just make sure the healing is okay. You stubbed your toe, but within a couple of days, they're walking again, not much bruising. Then stay home and you don't need to get care. But really what we suggest is when, you really can't get that cut to stop bleeding, or it does look very deep, or it's very long, then that's always the time to seek care. And if you're unsure of whether to go to maybe, an urgent care versus an emergency department, that's when your pediatrician or your primary doc can really step in, and you can give their office a call to help you figure out, which place do you need to go to in order to get that care.
So I know as an emergency physician, I have changed the way I behave towards my kids when they were little. And I'm curious, you have two kids. How have you changed your behavior toward your kids, given what we see in the emergency department, all manners of injuries and accidents?
So that is a great question. And the first thing that comes to mind is trampoline.
Uh, yeah,
So we do not have a trampoline at our house. We
yeah.
see in the summer, we see so many kids with trampoline injuries.
Mhm.
And most of the time it's because there are two kids on the trampoline and maybe
Yeah.
of different sizes. And we often see kids then who have broken their leg, or maybe, or who have fallen off, or they've hit their heads together. So that
Mhm.
is something that with my kids, we don't have it at our house. I have let them go on a trampoline, but it's always one person at a time.
And what
Yep.
about other
And
things
this,
like scooters and bike safety, that
Mhm.
kind of thing?
Yep. So anything with wheels, my kids know that they have to have a helmet on. They have a helmet on
Mhm.
anything that moves with wheels. So whether it's a scooter or a bike, and it doesn't even have to be motorized, but that helmet is on, or they don't get to ride it. Because so many times the families come in and they said, well, I didn't think that was going to happen. But that's why we prevent things from happening by wearing a helmet or closed-toed shoes. So my kids always have to have closed-toed shoes on when they're on anything motorized too, because we've seen enough broken toes, broken feet, ankles, and also the toenails coming off. So we want to
Yeah.
prevent that.
Oh, those are all great. Those are all great tips,
Mhm.
actually. I hadn't thought about the open-toed shoe one in quite some time, actually. So that's a good reminder. Now,
Mhm.
one of the other things I was just thinking about, we were just focusing on accidents and injuries, but of course, the summer does not relieve the burden of communicable diseases among kids. Kids are just little germ sharers. So talk
Yes.
about the kinds of communicable diseases that we see in the summer that you've seen lately.
So what we've been seeing lately is we've still been seeing a lot of kids with strep throat. And typically there is some seasonality to kids having strep throat, but right now our number of cases is still pretty high. So certainly if you have a child that has a fever and or sore throat and or belly pain and fever, so the younger kids, they don't always say they have a sore throat. So, but if they're having fever and some belly pain, that may be the time to get in to see their doc and maybe get that strep test. The other thing that we see this time of year, we're seeing obviously just some common viral illnesses, the runny nose, coughing, fevers, but we're really starting to see the hand, foot, and mouth disease. So that's where kids, they can have high fevers and then they can have spots on their hands and their feet, around their lips. We know we call it hand, foot, and mouth, but it really should be called hand, foot, mouth, whole body disease.
Right.
So that would also, there's not much that we can do for those kids, but we just have to make sure that we're controlling their fever and making sure that they're staying hydrated.
Excellent. So one other thing I was kind of just curious about, do you let your kids go into public swimming pools?
Yes, yes. So my kids are allowed to go into public swimming pools, and I'm glad you brought up water sports, because certainly we do see injuries from the water sports, and unfortunately we do see some kids, with drowning. So we have to be very, very careful about kids and when they're in water or even near water, because the youngest kids, it only takes about an inch of water for them to drown. And I don't think most people know that. And that's how careful we have to be when we're watching these kids. So I let my kids in, a public swimming pool or any swimming pool, but at that time, either it's me or I know there is a designated person that is to watch the kids. Because unfortunately, the kids who get into big trouble, it's because there's a big group of adults around and not one person was in charge of watching them, because everyone else thought that somebody else was watching them.
Yeah, right.
So,
So,
yeah, if I could
one
really
of
tell parents that.
Oh yeah, no, that's a critical thing, especially of course in the summer. Pools become super popular. One final thing, I guess, part of pediatric care is what we term in medicine anticipatory guidance. That is, we try and prevent illnesses, as you've sort of talked about already. What are, I guess, the best pieces of advice that you might have to help parents keep their kids out of an ER this summer?
Great question. To stay out of the ER, again, helmets. When they're on anything with wheels, wear a helmet, because we do see a lot of kids that fall off. They hit a crack in the sidewalk or they go off a curb and they fall off and they hit their head. And if they have a helmet on, you're actually much less likely to have to bring them into an emergency department. So wear those helmets. And also is sun and heat safety. So as much as you can, it's really, really warm right now, and it's probably going to be warm this whole summer. So as much as you can, limit some of the outdoor activities if they're really going to be playing sports from 10 to 4. So that's the hottest time of the day. Make sure your kids are wearing sunscreen. Just because every burn adds up. We want to prevent skin cancer from later. And when you're around water, make sure there is someone designated to watch the kids, even if you think they're really good swimmers.
Outstanding. And I will remind parents also to make sure that their kids are drinking adequately and staying hydrated as a final thing.
Absolutely.
But Dr. Levasseur, thank you so much for talking to us this morning. I really appreciate it. Again, Dr. Kelly Levasseur, she's the Assistant Medical Director in the Emergency Department at Children's Hospital of Michigan. Thanks again.
Thank you.
Very good information. Thanks, Dr. McGeorge.